Angelica Biorean from BSN2A. So for today, I'll be performing or demonstrating the proper procedure of coughing exercise. But first, let me define what is coughing exercise. So it is an involuntary reflex, or it can be controlled as a healthy natural way for the lungs to get rid of mucus. Voluntary coughing in conjunction with deep breathing can facilitate movement and expectoration of respiratory tract secretions. So for its purposes, first, to loosen and carry mucus through the airways without causing them to narrow and collapse. Second is to clean the airways and help breathe better. And then third is to lower the chance for infection. So for the materials needed, first is the folded towel or pillow, but I'll be using pillow. And then tissue paper. And then garbage container. So for the points to remember, first, the patient must not cough on the point of exhaustion. And then second, encourage the client or patient to perform 2 or 3 breaths, then rest for 5 to 10 minutes. And then discourage the client or patient to take quick or deep breaths through the mouth, as it can block the mucus coming out of the lungs. And then fourth, controlled coughing technique must be done after bronchodilator medication is given, or after giving the bronchodilator medications. So for the special consideration, ensure that the patient is comfortable. For the procedures, first, explain the procedure to be done and why it is necessary. Good day, ma'am. I am Maria Angelica Biorean from Southern Luzon State University, and I am your student nurse for today. And ngayon po, i-guide ko po kayo or ituturo ko po sa inyo ang proper coughing exercise. Ito po ay para magkaroon kayo ng maayos na paghinga, at the same time, mawala po yung parang nakabara sa lungs nyo or sa throat nyo po na plema. Yun po ang main purpose nun. And mamaya po is uupo po kayo para mas magawa nyo po ng maayos yung procedure. Okay po ba? Okay po. And then, perform hand hygiene and other infection-controlled procedures. Then, assist the patient to sit comfortably on the chair with and keep both feet resting firmly on the floor. And then, lean forward slightly, or sitting or in sitting position in bed or on the side of the bed. So, ma'am, kaya po bang tumayo? Okay po, upo po kayo dito sa side ng bed nyo. Pwede nyo po munang i-remove to. And then, yung feet nyo po is, ilagay nyo lang po sa floor. Meron pong sleeper. Relax lang po. And medyo lean po tayo ng konti. And then, may ipoprovide din po ako sa inyong chair, pillow, para po sa may abdomen nyo, para mas comfortable po. Pwede nyo pong i-place yung hand nyo. Yan. Lean forward po. And then, for the next step, instruct the patient to take gentle breath in through the nose and hold the breath for 3 seconds. The abdominal muscle should be tightened, and slowly out for 3 to 4 seconds, then cough twice. The first cough will loosen sputum, while the second cough will move the sputum high in throat and out. So, bali ma'am, ang gagawin po is, hihinga po kayo ng malalim, at then, mas okay po kung galing po siya sa diaphragm nyo. Yung paghinga nyo po, di parang mararamdaman nyo pong magta-tight yung abdomen muscles nyo po. And then, hold your breath po for 3 seconds. E di, bibilang po ako ng 3 seconds. Tapos po, pause. And then, slowly po, para pong nakamuso yung lips nyo, parang sumisipol po. Slowly po, dahan-dahan nyo pong exhale. And then, pagkatapos po nun, after 4 seconds of exhaling po, ubo po kayo ng 2 beses. Yung para po lumabas or mag-loosen yung sputum po. And then, yun po ma'am, nakuha po ba? Kaya po bang gawin? Sige po ma'am, hinga po kayo ng malalim. Okay, 1, 2, 3, exhale po. 5, 6, 7, and then cough po, ubo po. Okay po. Ngayon po ma'am, may ibibigay po akong tissue paper. So for the next procedure, instruct the patient to cough 2 or 3 times as they exhales into mouth slightly open. So remember that the cough should be short and sharp. And then also instruct the patient to spit up the sputum into a tissue paper and check the color. If it is green, yellow, or red, refer the patient to his or her doctor or physician. And also instruct the patient to throw the tissue paper into the infectious garbage container. And if there is no sputum, encourage the patient to take a break and repeat the controlled coughing once or twice. So ma'am, ito po ang tissue paper. And meron po akong garbage container. Ngayon naman po, ang gagawin po natin is, inhale po kayo. Inhale po kayo, tapos po pause for 3 seconds. Bibilang po ulit ako ng 3 seconds. After po ng 3 seconds na yun, diretso ubo po kayo. Tapos po, kapag po may naramdaman nyo po yung plema is nasa may mouth nyo na po, iluwaan nyo na po siya dito, and then ipakita nyo po sa akin. Tapos, diretso nyo na po siya dito sa container na ito, sa plastic na ito. Gets po ba ma'am? Okay po. Inhale po sa abdominal muscle, sa diaphragm, magsimula, inhale. 1, 2, 3, and then ubo po. Dito nyo po, Okay. Patingin po. Okay po. So, ma'am, okay po. Thank you po. And for the aftercare, assist the patient in comfortable position and let the patient rest. So, bali ma'am, lalagay ko lang po ito sa trash bin. And then ma'am, pwede na po kayong humiga ulit. Thank you po. For the documentation, document the sputum, color, and amount. And then, document the rate, depth, and character of respiration. Then also document the breath sounds and placement of sounds. And then lastly, document any signs and symptoms of respiratory distress.